Hi, Mr. T. First of all, I want to thank you for being here today in support of Miss T as our care partner. Before we begin today, I just want to check in and ask how you're doing, as well as how Miss T is doing.
Yeah, thank you. We're both doing good given the circumstances, but it's been difficult.
Yeah, I totally understand this is a really hard time you guys are going through. I want you to know that me, as well as the rest of the care team, we're here to support you and Miss T every step of the way in her recovery.
Awesome.
So today I'm going to walk you through the results of her evaluation, what they kind of mean, and also what her therapy plan is going to look like overall.
Okay.
I'll also teach you two techniques that you'll be using and supporting her at home with. So Miss T's swallowing was evaluated using a moving X-ray called a modified barium swallow study. This allows us to see how food and liquid was moving through her mouth and her throat. What we saw, if you look at this image over here, this is an animated side view of the mouth and the throat. And so what we saw was the muscles in the back of her throat back here. They weren't working as strongly or as quickly as they should. And I want to let you know this is common after a neurological event. For thin liquids like water, the swallow sometimes started a bit late. When that happens, liquid could get too close to the airway, and in a few instances, some liquid did slip toward it, toward the airway. So comparing the image on the left to the right, you can see that the image on the left, the bolus, which in this case is food, it's moving together as one piece and going straight into the esophagus the way that it should. The epiglottis, which is this flap over here, has folded down to help cover the airways so nothing enters the trachea. In the image on the right, you can see that same flap, it's still upright. When this happens, it means the swallow hasn't triggered yet. The food reached the throat before the swallow response happened, so the epiglottis hasn't had a chance to fold down yet. When the swallow is delayed like that, the airway is still open, and that's why material can slip into it like that. Miss T was able, when we saw this on her results, she was able to cough and clear some of that material. It was a good protective response, coughing, but not everything was clear. With thicker liquids and purees, things were a little safer, but we did see some residue and reduced muscle movement. So residue will happen after a swallow. It's leftover food or liquid, and the residue will occur in the pharyngeal cavity down here and even in the oral cavity up here. Overall, all these patterns that we're discussing, they are consistent with moderate to severe oropharyngeal dysphagia, which means that her throat muscles need strengthening and coordination work to help her swallow safely. Do you have any questions about that?
I don't think so. Not right
None.
now.
Okay. So now that we've talked about her results and gone over all of that, I want to move on to how therapy works and what our goals mean. So, swallowing therapy, I like to think of it as similar to physical therapy. We're strengthening the muscles involved in swallowing and retraining the timing of our swallow to protect the airway. Over time, this will help prevent food or liquid from going down the wrong way. Everything will be slow, steady, and matched to her progress. Do you have any questions about that? Anything I just went over?
Yeah, what do you mean by less restrictive diet?
Yeah, of course. So when we talk about moving toward a less restrictive diet, we simply mean allowing Miss T to eat a wider variety of textures and drink them as well. Right now, we're limiting her to purees and mildly thick liquids because those are the easiest for her throat muscles and the safest for protecting her airway. Does that make sense?
Hmm.
Okay. So as her swallowing improves with therapy, we'll gradually reintroduce more foods, and these foods will require more chewing or control. So things like soft solids, minced foods, or even eventually regular textures. So the goal is to help her return to eating as normally as possible, but again, only when it's safe. Now I want to move on to the techniques that we're going to be going over today. There's going to be two of them. I'm going to model it after I explain what the technique is, and then I'll have you try it out. Is that okay?
Hmm.
All right. Okay. So the first technique that we're going to go over is called the effortful swallow. This exercise helps strengthen the muscles in your throat so that they squeeze harder and they move food down more safely. I like to think of it as like lifting a weight at the gym, but for your throat muscles. So here's how you do it. Watch as I swallow with more effort. Did you see how you can kind of tell my neck muscles were more tense?
Hmm.
Yeah. So I want you to give it a try now, but first I want you to swallow like you normally would so that you can kind of compare the two. So go ahead. Good. Now this time, I'd like you to really squeeze all those muscles in your throat, almost like you're swallowing a big piece of food. I want you to feel a pull, a stronger pull in your throat when you do it. Good. Did you feel your muscles were tighter that time
Yeah,
compared to the
definitely.
first time? Yeah. Now this time I want you to swallow using the effortful swallow. So this time I want you to squeeze all those muscles in your throat, almost like you're swallowing a big piece of food. You should feel stronger pull in your throat when you do it. So you can go ahead whenever you're ready. Great. Did you feel like your muscles were tighter that time?
Yeah.
Yeah. We're recommending the effortful swallow for Miss T because her throat muscles aren't squeezing quite as strong as they should be. When the squeeze is weak, a little bit of food or liquid can stay behind in the throat. That leftover material can then slide towards the airway after the swallow. This exercise is like strength training for those muscles that push food down safely. The stronger the squeeze, the safer and more effective the swallow becomes. Do you have any questions about that exercise?
Yeah. How many times a day are we supposed to do this exercise? And are we supposed to do it with food and water?
Yeah, that's a great question. So, we'll recommend that she does 10 repetitions of that 2 times a day, only as a strengthening exercise. And what this means is that it's not something that she'll have to do while eating or drinking. We're just focusing on strengthening those muscles with this exercise.
Okay.
Does that make sense?
Yeah, it
Yeah.
does.
Okay, awesome. So the next exercise we'll go over is called the swallow, cough, swallow, which, unlike the effortful swallow, it's a protective strategy. So she will be using this one while consuming food or liquid. Okay. So she'll use this anytime after a swallow where she feels uncomfortable or, like she has something stuck in her throat. So this one helps make sure that nothing is sitting near the airway after you swallow. So it's a simple 3-step sequence. Step one is you take a sip or a bite of something and you swallow. Step two is right after you give a strong cough. And then step three, then swallow again to clear anything that cough might have moved. Okay? I'll model this technique with my glass of water and then I'll have you try it. Okay?
Okay.
And it's as simple as that. So you just take a quick sip, swallow, cough, and then swallow again. All right? Do you feel comfortable giving it a try?
Sure.
Okay, go ahead. Great. You did that perfect. So when Miss T uses this, you can help by making sure that she's sitting upright, she pauses between each sip, and that she doesn't rush through it. All right? So this exercise is going to be important for Miss T to keep her airway protected. On her swallow test, we did see a little bit of that liquid came close to the airway before the muscles fully closed. So this strategy gives her throat a chance to clear anything that might have gone the wrong way. Does that make sense?
Mm-hmm.
Yeah. Do you have any questions about the swallow, cough, swallow?
Not right now. Thank
Okay.
you.
Do you think you feel comfortable supporting her with these two exercises at home?
Yeah, definitely.
Yeah, okay, good. Now that we've gone through the exercises and those safety strategies, let's talk about what you'll be doing at home with her. So, your role and your support makes a huge difference in her progress. So, I've put everything into a home program for you. That way, you'll know exactly how often to practice and when to use each technique.
Okay.
So, I will show you that, and you'll also be able to take this home with you.
Okay.
So, if you'll take a look at the Swallowing Therapy Home Program, for homework, I'd like her to do 10 effortful swallows, 10 swallow, cough, swallow sequences, and she'll be doing those twice a day. Over here on the second page, You'll see a simple chart to mark when these exercises are done. She should be sitting upright, fully alert, and also make sure she never pushes through fatigue as well. If you ever notice more coughing than usual or any extra discomfort, just simply stop and let me know. I put my contact information on the last page over here.
Okay, great. Thank you.
Yeah. So thank you, Mr. T, for being here today. Once again, I know that this was a lot to take in, and you definitely don't have to have it all memorized. I have a lot of the information we discussed on the swallowing therapy home program, and I just want to briefly go over it with you. So, up here, we have just a brief explanation on Miss T's swallowing changes. And then we went over her current dietary recommendations. We went over her swallowing exercises to practice at home and how often she'll be doing those. There's also safety tips for eating and drinking, which most we went over today. The safety tracking chart that I showed you. These are some points of when to stop exercises and call the therapist. And then my contact information is right under that. Okay.
Thank you.
All right. Thank you, Mr. T. Before we finish up for today, I want to ask if you have any more questions.
Not right now.
No?
Mhm.
Okay, great. Thank you so much. Your support means a lot, and I look forward to following up with you at Miss T's next session visit.
Thank you so much.
Give you this to take home. Thank
Thank
you.
you.